it's one of the basic practical that we have from blood module. So let's begin. First, you need to know what is a specimen. A specimen is a sample of something such as blood, tissue, urine, sputum, obtained for the purpose of medical testing. And what is specimen collection? It's defined as collection of specimen for the purpose of diagnosis, treatment, and recovery. So it's the first step towards making a diagnosis and carrying out treatment. So basically what it is you have a patient. हमारे पास एक when a patient comes to you, you need to carry out a proper clinical methodology. Like there are various steps. First you take the history, then you examine the patient, then you make differential diagnosis, then you make provincial diagnosis, and finally to confirm your diagnosis you have to send certain labs. So being a physician, it's very important for you to know the kind of labs that you need to order for a kind of disease that you're suspecting or you want to diagnose. So हम लोग like suppose for example, if you have a patient whom you are suspecting to have diabetes, तो आप क्या करेंगे उसका? You will order for the collection of blood to send for the fasting blood sugar and random blood sugar. So this is why we basically collect the specimen. So it's a first step towards making a diagnosis and carrying out the treatment. And what are the types of specimens analyzed in lab? कौन-कौन से specimens हम routinely send करते हैं? Blood, ठीक है. We send blood for CBC, complete blood picture, for glucose, for lipid profile, for total, for enzymes. And then we have sputum. Sputum हम लोग कैसे करेंगे? If a patient has some sort of respiratory disease, उसके लिए we are going to send the sputum. Then for urogenital diseases or certain other disease, like if you want to monitor certain your treatment, like in a diabetic patient you also send urine sample. अगर आपको देखना है if a patient is responding well to the treatment or not, if he's having glucose in urine or not. फिर उसके बाद we send saliva for diagnosing certain diseases. We send feces for GI diseases. We send bone tissues for histopathology to rule out certain diseases, like to diagnose whether a patient has some pathology, some cancers or some growth, tumors. उसके लिए हम bones या tissues भेजते हैं histopathology के लिए. फिर हम cerebrospinal fluid भेजेंगे पेशेंट का, और synovial fluid भी भेजते हैं. Cerebrospinal fluid to rule out certain disease of the brain and the meninges, if a patient has meningitis or cerebral tumors or subarachnoid hemorrhages. Then we also send synovial fluid to rule out certain diseases like joint diseases. So this is the reason why we send for the blood specimen, the various specimens, to get the patient tested for certain diseases so that we can reach a diagnosis. Now there are two types of lab investigations. There are qualitative and quantitative. The qualitative tells you if a particular substance is present in this specimen. For example, हमारे पास we test a pregnant female's urine for urine pregnancy test. तो उसमें हम क्या करेंगे? We send the urine sample to know the levels of beta HCG. So in a pregnant female, the beta HCG levels are very high. It's going to give you the urine pregnancy test is going to give you the a positive or a negative result on detecting the beta HCG, but it's not going to give you the quality of the quantity of the beta HCG. It's just going to give you the quality. अगर आपको quantitative analysis करवाना है, तो you need to write down beta HCG levels in blood. You have to specifically send for the blood levels. तो फिर उसमें क्या होगा, उसमें हम क्वांटिटी देखेंगे बेटा HCG की, और वो that quantity is going to indicate whether patient has had abortion or the patient has abnormally high levels of beta HCG indicating twin pregnancy or trophoblastic disease, molar pregnancy. So this is the difference between qualitative and quantitative. Now, specimen handling and labeling. Specimen handling and labeling should be done with utmost care, because if you do not maintain the quality of the specimen, then you'll not get the right results. So care should be taken regarding the quality of the specimen. It should be the right specimen first. If the doctor orders for blood, you need to send the blood. You cannot send urine instead of blood. And it's collected at the right time. Like if it's required that your patient fasts for 8 to 12 hours, so you need to collect the blood after the patient has fasted, not before that. And it should be properly preserved and sent to the right lab. And collection should be from the right person. It's also important, because if you mistakenly collected from the wrong person, you'll get the wrong results. So it's important that you maintain the quality of your specimen, and it should be labeled with the patient's name, patient's history number, the date and time of collection, and initials of the patient collecting. Initials of the person collecting. So if the phlebotomist is collecting, he needs to write his name, and the time and date of collection, patient's name, so that the specimens or samples don't get mixed up and they reach the right lab, the right person gets the right report. Now, what are the methods for blood collection? There are 3 commonly performed methods for blood collection: the arterial sampling, the venipuncture sampling, the capillary sampling. So the arterial sampling is usually employed in hospital settings, mostly performed in patients with metabolic, respiratory, mixed acid-base disorders, where blood is taken from an artery. So here you are drawing the blood from the artery. And it's usually drawn from brachial artery, femoral artery, radial artery, and the temporal arteries. So the test that is commonly performed is ABGs, arterial blood gases. You check the ABGs, arterial blood gases, by attaining an arterial blood sample. Now, venipuncture sampling. Venipuncture, it's very commonly done. It's commonly done for most of the diseases. Blood is obtained from a patient's vein. And capillary sampling, it involves taking very small amount of blood from the end of patient's finger pulp or heel pulp by slightly pricking it with a lancet. Now, venipuncture is the process by which a blood specimen is obtained from a patient's vein, like I discussed. So what is the site of venipuncture? The median cubital vein in the cubital fossa is preferred site for collection of the venous blood in adults. Because the vein is large and close to the surface of skin, it's easily detected, it's well anchored. So we usually prefer the median cubital vein. Now, here in this picture, the entire procedure of venipuncture is given, and you can see all the minor details. So before even we begin collecting the sample, before we even begin drawing the blood, what you need to do is, and especially WHO has they have set certain guidelines for blood collection in patients who have who get disease like Ebola or COVID-19 type diseases. Whenever there is an epidemic or a pandemic, they have more stricter guidelines for venipuncture. You need to come in a personal protective equipment. You need to make sure that your all the necessary waste is properly disposed of, and the sanitizing techniques are good. You disinfect the place properly. There's no contamination. So what you need to do here in this procedure is gather all the equipment first, wash your hands and put on sterile gloves. Then ask the patient to make a fist and select the venipuncture site in the antecubital fossa. As you can see over here in the picture, after the person is wearing gloves, he's looking for the vein. It's not necessary that you always get the preferred vein. Sometimes you can prick some vein that's not preferred, like it comes second, but you can easily find it and prick it and get the blood drawn from it. So then you have to disinfect the area with an alcohol swab working from the center outwards. Later you apply it, like after you have disinfected the area, you apply a tourniquet about 3 to 4 inches above the site. Now here I want to mention something really important. You cannot leave the tourniquet for like more than 1 minute because it causes heme concentration. And what heme concentration does, it alters the results of your investigations. Like your blood sugar levels will be altered, your your cholesterol levels will be altered. So they're going to give you negative results, wrong results. So you need to make sure that you do not leave the tourniquet for more than a minute to avoid heme concentration. Then you anchor the selected vein with thumb and your index finger. Once you have applied the tourniquet, position the needle at a 30-degree angle. So angle is very important. If you put it at the right angle, you immediately get the blood. Enter the vein swiftly and ensure blood is flowing. Then after the blood has been collected, release the tourniquet before withdrawing the needle. Apply a gauze or a cotton ball to the needle entry site. Ask the patient to hold it in place. Remove and immediately invert the tube 8 to 10 times to mix the sample with tube additives. So whenever we have got tubes, we have got the tube additives. Most of the times, I'm gonna discuss it with you in detail shortly. Then you discard the used needle in the sharps container. Remove gloves, wash hands with soap and water. Label the tube for transport to the lab, indicating patient's full name, patient's ID, date of birth, date of sample. Next, components of blood. There's a reason why I think it's important to discuss with you the components of blood, because blood is analyzed for various biochemical parameters in 3 different forms: the whole blood, plasma, and serum. So as you can see over here, we have kept the blood and the erythrocytes, the cellular component has sedimented down, leaving a plasma above. So the whole blood has plasma, red blood cells, erythrocytes, leukocytes, and platelets. Plasma is a fluid portion of blood with fibrinogen, while serum is the fluid portion without fibrinogen. So you leave the blood and you get whole blood. You get the blood which has a cellular component, erythrocytes, leukocytes, platelets, and then you get the plasma liquid portion on top. And serum, which is the fluid without the fibrinogen. So plasma has fibrinogen and serum is without fibrinogen. As you can see in this picture over here, there is whole blood in one tube, and the other tube we put the anticoagulant with the blood, and you see the cells have settled down while the plasma stays on top. While when you have blood without the coagulants, you can clearly see that the serum has separated. Separation of serum and plasma from blood. To obtain plasma, blood is collected in a tube containing anticoagulant and given gentle rotation. So the tube is then centrifuged at low or moderate speed. The upper liquid portion is carefully separated in another tube. So हमें चाहिए serum और plasma blood में से, ठीक है? तो फिर हम इस तरह separate करेंगे. अब हम plasma serum किस तरह करेंगे? For serum collection, blood is collected in a tube without anticoagulant, and tube is allowed to stand for 30 minutes for the clots to form. So the clots are separated from the tube after centrifuging the tube at 2500 rpm for 10 minutes. The resultant supernatant is carefully removed using Pasteur's pipette into another tube. Now let's discuss some anticoagulants. Since blood clots in a few minutes after it's drawn from the body, so anticoagulants are needed to prevent the blood from clotting. And they're used when whole blood and plasma are needed for testing. So there are certain anticoagulants: the EDTA, ethylene diamine tetraacetic acid, the oxalate, citrate, and heparin. These are the most commonly used anticoagulants. Now let's discuss the vacutainer tubes. So what is a vacutainer? A vacutainer blood collection tube. It's a sterile glass or plastic tube with a colored rubber stopper, creating a vacuum seal inside of the tube. It facilitates the drawing of a predetermined volume of liquid. So as you might have seen, if you have gone for testing, for getting your test done, for getting your blood sample drawn, you might have seen that the phlebotomist uses different colored tubes. You know that the tubes have different color stoppers, like they are gray and they're purple. Like as you can see in the picture, there's a black one, blue, purple, red, green. Now we're going to see why there is a specific color. So the purple or lavender, it has EDTA, anticoagulants, and we collect the blood for CBC, blood typing, RH factor and ABO screening, cross match, HB, red cell indices. So when we need these tests to be done, we send the sample in a purple lavender tube containing EDTA. Light blue trisodium citrate. Light blue has trisodium citrate anticoagulant, and it's used for when we need to test the blood for prothrombin time, activated partial thromboplastin time, APTT, fibrinogen thromboplastin time, and other blood coagulation tests. So, like I told you before, we will discuss it later. So first let's get done with the tubes. Gold, commonly known as serum separator tubes, for BMP, CMP, LFTs, KFTs, lipid profile, and other biochemistry assays, serological tests are done. Red, commonly known as a plain tube, it has 0 additives, and it's used for collection of serum for selected lab tests like lipid profile and serology tests. Then the dark green has sodium heparin, it's for ABGs. The gray, sodium fluoride, blood sugar testing, toxicology tests. And last but not least, we have black trisodium citrate anticoagulant for ESR. So this is a very good picture where you can see the colors. The stopper colors are the color coding, and the anticoagulants used and the tests. But before we discuss the order of draw, I want to discuss with you whole blood. So, why do we have to send the whole blood plasma serum separately? Because for certain tests we require whole blood, such as for CBC or glucose. You can test the levels, glucose levels from the whole blood. Likewise, we send plasma for lipid profile, cholesterol, total proteins, albumin globulin ratio, and also glucose. Then the serum is sent separately for for serum bilirubin levels, for certain enzymes like T3, T4, TSH, iron profile, like serum ferritin, and electrolytes, sodium, potassium, chloride, bicarbonate, calcium, urea, and uric acid. These are the electrolytes. So sometimes we have to send the whole blood. Sometimes you have to send plasma. Sometimes you have to send the serum. So when you have to send 3 or 4 different specimens, then you need to follow an order of draw. This order of draw should be followed whenever multiple tubes are drawn using a single venipuncture. You have the same patient, you have to perform a single venipuncture, and you have 3 or 4 samples or 3 or 4 specimens to send, and they require different color coded tubes. So you have to follow a certain order for that, and it's to prevent cross contamination by the tube additives that could lead to erroneous results. So what should be the order? Firstly, blood culture, then plasma, light blue top with 3.2% sodium citrate. These tubes are used for coagulation tests and need to be completely filled to ensure the proper ratio of blood to anticoagulant. Then red top serum, plain and gel, used for chemistry and reference tests. Green top plasma with and without gel contains lithium heparin, and these are used primarily for chemistry tests. Lavender, like we discussed all of the colors previously, contains EDTA, used primarily for hematology and blood bank testing. Gray top contains sodium fluoride, potassium oxalate. It's used for chemistry for glucose testing. Yellow top, plasma and cells, contains ACD solution, used for genetic testing. So this should be the order of draw. So this concludes our presentation, and I hope you guys understand. You guys have we have discussed all the objectives, the necessary objectives in this presentation, and also there is a short message for you guys. Please maintain social distancing and frequently indulge in hand washing for more than 20 seconds. Use masks when needed, and keep yourself and your surroundings clean, and also educate the masses, educate people about this pandemic, so that we can flatten the curve and things resume like they have been before. So I hope you guys take care. Inshallah, see you next time. Inshallah, next time I hope to present something else.